maternal health in historical context. Just a couple quick housekeeping items before we get started. This webinar is being recorded and will be made available afterwards. The Maternal Health Learning and Innovation Center is supported by the Health Resources and Services Administration. The information or content and conclusion of this webinar are those of the presenter and should not be construed as official position or policy, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Everyone is muted, but we still want to hear from you, so please use the chat for greetings, responses, and questions. We'll be keeping an eye on it and we'll answer questions during the Q&A session at the end of the presentation. I will now turn it over to Dr. Kimberly Bugg, who will introduce our speaker, Dr. Jann Murray-García.
Good morning to everyone on the West Coast, and good afternoon to those on the East Coast. We actually are expecting participants from throughout the country, so I know it's very early for some, and some of us are having lunch. I am Dr. Kimberly Bugg, and along with Dr. Sarah Verbeest, we are the co-chairs of the Engagement Corps. So the Engagement Corps and myself, Dr. Verbeest and myself it is our pleasure to introduce you all to Dr. Jann Murray-García. She is a founding faculty member and associate clinical professor at Betty Irene Moore School of Nursing at UC Davis. With Dr. Melanie Trevelyan, Dr. Murray-García coined and developed the concept of cultural humility in her most oft-cited publication, Cultural Humility versus Cultural Competency, a critical distinction in defining physician training outcome in multicultural education. She is a trained pediatrician who received her undergrad degree from Stanford University, her medical degree from UCSF, and completed her pediatric residency at Oakland Children's Hospital, followed by a master's degree in public health from UC Berkeley. For more than a decade, Dr. Murray-García has been involved in a unique school community youth partnership to close racial advancement and discipline gaps in Davis, California public schools. So I am very honored to present to you Dr. Jann Murray-García.
Good morning, everyone. Thank you so much, Dr. Bugg, and all of the folks who helped make this technically possible. I know there are a lot of folks out there. Ideally, I would do a longer presentation, even several days. I have a class that goes on for a year, but we've got about 90 minutes, maybe 80 minutes to get through a lot. So I wish we could be more interactive. I will ask a couple of questions and you can answer in the chat box. And but I'm gonna zoom through a lot of things, if that's okay, so that you get the most of me that you can, and then hopefully you will follow up with one another within your organizations or within your professional groups with any discussion issues. Okay, so we're going to talk about Black maternal health in historical context and kind of make a distinction between cultural humility and cultural competence, and why humility is the more appropriate stance or orientation when you approach trying to decrease Black maternal mortality. All righty. There you all know what's going on there. That's me. And so we will go through cover four objectives, learning objectives today. So hopefully by the end of this, you'll have some sense of how to hold yourselves and your organizations responsible for how issues of race, power, and identity can affect the work we do with one another, and in delivering health and human services. Hopefully we'll be able to appreciate more the contentious historical context in which Black women in America have nonetheless achieved health, and how that historical context continues to undermine their efforts. And I see there's some chat, there's some messages in the chat, so let me know if I need to do things differently. We're going to make visible and again, be accountable for the often unspoken social scripts we ascribe to the other and to ourselves. Those scripts can negatively impact our encounters. And my idea is that if we can see the scripts, then we can interrupt them and potentially transform them before we hurt someone or deliver inequitable care. And then we're going to outline key components of cultural humility as an approach to equitable health care. Okay, let's see where we're going first. I just want to contextualize what we're doing in the history of our country so that you know this is what we're leading with every day, even though we don't see it. This is a backdrop to the services we provide to Black women. Okay, this video has no sound. I'll tell you it's about the Atlantic slave trade. Every dot is one of the 22,000 slave ships that came from Africa to different parts of the West. The size of the dot is the size of the number of enslaved Africans who were taken from their home. So here we go. Again, there's no sound. We're starting at 1500. So you see the Atlantic slave trade is starting. What you'll notice is that most, over 90% of the ships went to South America and the Caribbean. I hadn't noticed the transport of slaves to Europe before on this. So we're coming up to the American Revolution. Just about there. Okay. And if you remember, the Constitution, as was written, banned the import of enslaved Africans to North America after 1808. All right, and you'll come to 1850, the Fugitive Slave Act, and coming up to, there we go. So I understand that that's very difficult to watch, but I really do think it's important to understand that the context in which we do our work with Black women every day. I'll make sure I get out of that before it starts. So let's just take a few seconds and just think about that. I know that's a difficult 2 minutes to watch. And if we could think about language, so I try not to say slaves were brought to the United States. I try to say enslaved Africans. An old Black woman taught me that, so that we understand. Again, I'm going to come back to this. There's nothing wrong with Black women. It's what was done as part of how we became America. The same thing with, I don't use the term minorities unless I'm using air quotes. I use minoritized. The minoritized, I don't use our minorities. I say the minoritized, again, because so important how you define that, right? Because how you define the problem, how you name those you are coming alongside, really influences how you're seeing what you need to do or what your organization needs to do. So these are issues of power, these are issues of differential resources, these are issues of differential value that dictate implicitly people's different approaches to us behaviorally. So the other thing is the difference between health disparities and health inequities. So health disparities is the quantitative profile of how health status, healthcare allocation of resources, healthcare quality can be different. That's just a matter of fact. Healthcare inequities, which we should all be trying to reduce, implies issues of power, again, differential distribution of resources, including those resources for excellent health that exist in our society. So we're talking about institutions, we're talking about histories, but really important, again, to see ourselves in the context of history. I don't know how many times we do that before we start in on trying to solve people's issues. Here are my babies. This is what I do this for. This is why I enter into these very difficult conversations. Again, no financial disclosures or conflicts of interest. And my long-haired Mexican husband and I are trying to put them through college. So wish I did, but I don't. Okay. We've talked about the objectives. I'm gonna take you through a quiz if I could. I want you to guess this community if you could. Members of this minority community were brought to this country as slaves. Many remain at the bottom of the economic and social ladder today. They do the dirty work when they have work. The other members of this community think members of this minority are intellectually inferior, if not stupid, and discrimination against them in the areas of housing, employment, and education is not unusual. Over the years in this community, tensions between so-called minority and majority have broken out in deadly riots. In the past, minority children in this community were forced to attend segregated, underfunded schools, and many did poorly in school. Today's schools with a high concentration of this minority's children have high dropout rates. Many majority parents move out of the school district or send their own children to private schools. Children from this minority community are disproportionately in trouble with the law. And not unexpectedly, children from this community do worse on standardized tests than majority children do. You can guess this community, and I would love for a couple of people to be able to guess in the chat. What do you all think? What's this community? Is my screen still not on the PowerPoint? You all are okay. Good. Okay. I see that. Latinos. Latinos were not brought to this country as slaves. and in reference to Mexican Americans in particular, folks were encompassed into the United States. A lot of people say Native American, which I can completely understand. Of course, this is their land. I'm on the Winton Nation's land, the Patwin Nation's land here in California. But they weren't brought here as slaves, right? We know a lot more about how much slavery was a part of their existence here, but they weren't brought to North America as slaves. There's a book called The Other California. I'm sorry, there is a book called The Other California, but this book I'm referring to is called The Other Slavery. It's an award-winning book about Native Americans and how they were enslaved on the North American continent, but they weren't brought here. When I read this, I thought, like most of you, that this was talking about African Americans or Black folks. But the answer really is Koreans in Japan. So if I could tell you that story, because when I read this, I was like, you got to be kidding me. This sounds like Black folks. This sounds like my folks here in the United States. Here's the story. Japan colonized Korea and China in the earlier part of the 20th century. And laborers from Korea would go back and forth from Japan to Korea. Around the time of of World War II, Japan actually forced Koreans to come to Japan as slaves. And those people worked in the weapons industries, manufacturing. They were soldiers on the front line. They were so-called comfort women. When World War II ended, most of those Koreans left Japan and went back to Korea, but a small number stayed in Japan. And today, they were known then as the Zainichi Koreans, and today they're known as the Zainichi Koreans. And what I read you was a description not back from early 20th century, but today. And for all the world, they sound like African Americans to me, and probably to some of you other groups. But let's focus on that for now. And when I read that, probably about 15 years ago, 10 years ago, it really kind of took me off my foundation, because it's kind of like, wow, we're separated by an ocean, we're separated by time. You're not talking about race there, you're talking about ethnicity. Those aren't two different races. And it was really instructive for me, because then I could see, wow, these folks, say at the red level, the orange level, there's nothing wrong with them, even though a lot of our public health industry is built on the fact that we need to fix these disadvantaged people or teach them something that we know. We rarely problematize the system that recreates the minor citizen or the minority in our societies. We rarely will talk about disadvantaged and underserved all day, but we rarely problematize the advantaged or the overserved. Talk about underprivileged, we don't talk about the privileged so much. And I think that's what we need to be doing, is really thinking about the process. Again, the difference between a minority, these people we are paid to fix or help or make more like us, and the minoritized, which is a system level ongoing process of recreating inequality. And I started to think, man, there's this process that's invisible, and all of a sudden we wake up generations later, and even though we're all so liberal and we all, we drive our Priuses, we vote Democratic, we vote for Bernie, whatever it is we do, most of us do not, whatever spectrum we're on politically, do not want to see this inequality recreated. And yet, generation after generation, relatively speaking, that's what we have, a faithful reproduction of racial inequality in the United States. How does that happen? It almost to me sounded like there's a script that we're all performing together, much like the Sainichi in Japan today and the Japanese, that if we could see, if we could make visible, maybe we could interrupt before we perform that same script. If you think about, I just turned 57, what we're handing down to the next generation of Americans, our children, how does that happen? That we all wanted equality, and I've been here for 60 years and have not seen it come to fruition. Of course, in the last couple of years, I would say it's gone backwards in terms of the scripts that are bubbling to the top again. The idea that you can hunt down a Black man, an armed posse could come at somebody's door looking for a Black man. I like to talk about scripts because it's actionable. I'm not going to just say, oh, you have this bias, or oh, you have stereotypes. I'm sure you all have been to different trainings where that's what you come away from. If I tell you there's a script that we're performing and the skill is getting to recognize that script in the context of history so that it comes to your mind and you can interrupt it before you behave differently, because our behavior comes from our thoughts, whether they're recognizable thoughts or things we just do implicitly, subconsciously. So most important part of a script, where do we see a script? Real quickly in the chat box, where do we see a script? And I'm not trying to talk about critical race theory or sociological imagination, just really in our lives, where do we see scripts being used? Okay, let's kind of guess what I'm thinking. So I'm gonna go ahead, I don't see any chats. But we often in television, in theater, in the movies, right? What do we use a script for? Right, what to say, what to wear, where to stand on the stage, where we are geographically, our roles, specific roles, our roles in relationship to one another. I hope this analogy now is becoming clear, because if we can start to look at our institutions, at maternal mortality, at educational inequality, and start to dissect things like that, then we can start to look at, wow, the most important part of a script for me is the outcome is always the same. So if you're getting the same outcome with good people, to me, you got to start looking back and identifying these invisible scripts that we're performing together. So I like to say the outcome is most important part of a script for this analogy of hidden scripts. And it's kind of like if you were to spend a ton of money flying to New York City to see Hamilton, that would have been a waste of money now. But before, if you could go to San Francisco like we did and see Hamilton, if you got there and the play that was performed was Tyler Perry's I Could Do Bad All By Myself, you would be highly irritated, I'm sure, right? Because that's not the outcome you wanted. Even if you got to Hamilton and let's say, like I have, while I've watched it a couple times now, maybe Alan Burr won't shoot him. Maybe, but that's not what a script is about, right? Every time I see that play, every time I read the story, the outcome is always the same, right? Alexander Hamilton gets killed by Aaron Burr. So if the outcome is the same, we need to start looking beyond individual actors to a system and a set of processes, scripts that we're living together. So this kind of construct of the analogy of scripts kind of helped me start to answer the question, how come we can't find a racist and we continue to have all these racialized outcomes? Even in the most liberal, well-meaning, or liberal or well-meaning places, how come we can't, with all our heart, make these things equal? And it makes me think there's a script that we're not aware that we're all living together. So I want to talk about that analogy. This is Sheryl Sandberg, and she's the kind of the Facebook, one of the faces of Facebook. She talks about in the book Lean In, her analysis of why women are consistently underrepresented in corporate American leadership. Because it's not about women aren't as talented. It's not about there are just fewer women, like we like to say with applicants of color. There's something else going on. She talks about our entrenched cultural ideas. This is one of her reasons, or the script associates men with leadership qualities and women with nurturing qualities. And those scripts put women in a double bind. We believe not only that women are nurturing, but they should be nurturing above all else. When a woman does anything that signals she might not be nice first, nurturing and foremost, it creates a negative impression and makes us uncomfortable. And I would say sets up a cascade of behaviors that do not end in gender equality. It's interesting when I was reading her book, because she literally gives women a script to perform or to follow. She says, when you're going in to ask for a raise, here's what you say. It's almost like she's handing you the script that I'm talking about. She says, as silly as it sounds, pronouns matter. Whenever possible, women should substitute we for I. A woman's request will be better received if she asserts, we had a great year, as opposed to, I had a great year. Does that make sense? She's telling you how to set up a situation so you get back a specified behavior from the people you're trying to ask a raise from. And this is true whether the boss is a woman or a man. There's something about ambition in a woman looks like aggression, whereas in a man it looks like ambition or assertiveness. So there are gender scripts. Race is an important script. This is from 2004 Behavioral Risk Factor Surveillance System. That's one of the national studies that our government sponsors. This is from 2004, but I'm going to show you some data that are more recent. And on this survey, one of these telephone surveys, they asked, how often do you think about your race? So the options were once a month or less, once a week, or once a day or more. And I want you to look down here at how often Black and Latinos think about race. Once a day or more. That's extraordinary compared to how often that is a script that you're negotiating if you're a white person. And I'm almost positive this is going to be increased for white folks now. And that's not saying there's anything wrong with white folks. That's not, blaming people. It just is a piece of data so that if you're going in, you're working with Black women and somewhere in your heart you say, it's just not that important. This is just about good care. If you are not clear on the racial dynamics of American society, you are not going to get Black women. You're not going to get what we're worried about. You're not going to get the stress of how we have to negotiate our interactions, how we can't be angry, we can't be too smart. We don't want to be that stereotype of the mammy always taking care of people. That's exhausting and kills us, actually. But you need to know. You need to know that race is important in our lives. This is some of that data again, and this is from, I believe it's 2010 was the latest. So if you look at this line on the top, just to tell you that this is something that that is pretty consistent. These were Black women. This was a study of obesity, and that question, how often do you think about your race, is referred to as race-related vigilance. And if you can see daily or more than daily, it's about, again, 30%, 31% of Black women, of Black women in this case, think about their race at least daily. Okay. So I hope it's okay if I talk about race. Where do we learn these racial scripts? You can do your chat on this one. How early do we see these racial scripts appearing? When do they first appear in our lives? Anybody? Okay.
Started at preschool and birth, school, always prevalent.
Mm-hmm.
Everyone's
Very
answering.
good. So, yeah, you know, we can measure that infants recognize physical difference, but we really don't see kids attributing differential value to race until they're about 3 years old. So we know that from the doll experiments in the 1940s that Thurgood Marshall used and Kenneth and Mamie Clark used, we know that by preschool, American children have a different set of values for people of different races. And I'm going to show you a 90-second clip now. These kids are somewhere between 7, 8, 9, something like that. It's a diverse group of kids. It doesn't seem like that. I'm going to tell you it doesn't seem like that, but it is a diverse group.
We brought together 3 groups of kids at this day camp and showed them pictures of 2 men, one Arab, the other Asian.
Who do you like better, this man or this man?
The Chinese guy.
Over and over, they said they liked the Asian man more than the Arab.
We don't know how he knew it's Chinese. We don't know.
Because he looks nicer. Yeah, he does look nicer. And he has a smile on.
But both men are smiling. And what do the kids think about the personalities of the men?
Let me ask, you don't know this person, but what do you think he's like?
I think he's weird.
Why is he weird?
He just doesn't look like a very nice person. No. He looks like a scary dude.
He's on the phone. What's he talking about?
Maybe a robbery?
Then I ask about the Asian man.
What's he like?
He looks like a regular teenager to me.
We then showed them pictures of a black man and a white man. What were some comments about the black man?
He looks mean. FBI most wanted. He looks weird. He looks like he's a basketball player.
So, tell me about this guy. Does he seem like a nice person?
I think he's nice. I think he's nice, except he might be mad about something.
He was probably picking up on something. This is Oklahoma City bomber Timothy McVeigh. But when we ask which man is a criminal, most kids pointed to the black man. And when we asked which was a teacher, they said,
That one! The guy in the green shirt.
Wow. Powerful, huh? I've seen that so many times. Let me ask you a couple of things as I look at the chat. Tell me, good, I see all, yeah, heartbreaking, that's the way I describe it. Every time I see it. Let me ask you, what 2 careers did the kids talk about the black man having? Basketball, okay, professional athlete, good. Professional athlete, and what else? Criminal, right, FBI's most wanted. That's, for me, if you think about that, professional athlete and mass incarceration, it's like for kids who are not even 10 years old, how did they learn that script that we are living today? beyond the media, way beyond parents. Let me tell you, way beyond parents. I wish we could do a whole session on talking to children, young children about race. It's not just the parents. I bet you if you took the parents of those kids that you saw in that video, all of them would tell you they've never talked about race to their kids. They don't even, my kids don't even know about race. But this is the point, that by preschool, and certainly by 10 years old, you can elicit a value, a character, a script for people of different races. You heard the script for Timothy McVeigh. He might be mad about something. I think he's nice, but if that isn't the script we hear in public schools, where if a Black child or a Latin or a Native child does something wrong, they're suspended at 2, 3, 4 times the rate of a white child or an Asian child. If a white kid does something, they need counseling. If a Black child does something, there's something about the essence of who they are where our first response is punishment. Y'all feel me? Y'all feel me? It's like the person said, it's the ocean we swim in. And they're labeling it as white supremacy. And I like that term, white supremacy, because it just says, you saw it in the kids. There's something better about white. There's something superior about white. And if you ask me to make a comparison, I know who belongs on the bottom. Hello? Very, very early. You tell me how kids know before 10 years of age about our phenomenon of mass incarceration. That is such a powerful script, right? How did they learn that? They would not be surprised to find out that 1 out of 3 Black men in this country, sometime in their adulthood, will be in prison or on parole or somehow under the supervision of the criminal justice system. Do we really think that's about those kids? About the 1 out of 3 Black babies you see? Or is that really about a system that we are teaching very faithfully to be reproduced? Okay, let's go forward. So I just want to say, race is not something our chromosomes do to us. Race is something we do to each other. Those of you who went to Cal, UC Berkeley, know that this is spelled wrong. And I spell it wrong, and I spelled it wrong for over a decade because it kills me. I love this quote, but I am actually a Stanford Cardinal, so I hate quoting it, but it's a really great quote. It's a really great quote. Okay, let's talk about this now in terms of Black women and historical scripts. So some of those scripts I could ask a kid and they would manifest that script. But let's talk about, if we remember the 2-minute video on the Atlantic slave trade, we can come forward 400 years to how Black folks are more susceptible to coronavirus because that racial stratification of the workforce started at the founding, before the founding of our country. If you think about that, was from the 1500s, right? So I like, when we mention race and health, healthcare, and research without the socio-political context, and I know a lot of us do research, and a lot of us love to do regression analysis and put some things into a statistical equation, but we cannot forget, without that socio-political and historical context, it can lead to a kind of racial essentialism. And that is the concept that people of different races and ethnic groups possess specific traits and behaviors unique to their group. So that's what the kids were telling you, right? That's what these young children were telling you. There's something about brown people that is not true about white people. And if I could go back to that brief video clip and tell you that the Black man is actually a Harvard professor, a professor of economics at Harvard University. He's a MacArthur Genius Award winner. So I always like to tell people, I don't even think we realize what we're throwing away. People who could have come up with a cure for cancer, different cancers, are probably sitting in our prisons right now. People who could dismantle and deconstruct health inequities are sitting in our prisons right now, or undereducated, or somehow convinced implicitly that they could not get to the top of our economic and educational structure. You just remember in your high school who was in advanced placement classes and who was in the gifted program. If no one problematized that for you, all those things become normalized. So I like this from Karen Scott, who teaches at UCSF obstetrics. Really, really brilliant sister, really brilliant sister. When we think about how you might solve gender disparities or racial disparities, is it about, well, they need to, well, they're just, well, I worked hard for everything I have. I feel like we all have the same roles and opportunities. So when you see the gender inequalities, is that a problem with the gender, or is that a problem of sexism? And we have to remember that when we're problematizing and building programs for people. Is there something wrong with the Blackness of women, or is it racism? And we just haven't been taught to problem solve that. We're just taught to fix people, fix individuals, and not look at the historical context. My daughter, who's 23 now, is a straight up social justice gangster. Again, half Black, half Mexican. She says Blaxicans are gonna save the world. I believe her, I believe her. This is a pyramid in Mexico, near Mexico City. She says, Mom, she comes home with these John Oliver clips and Trevor Noah, which I hope I get to show you a little bit later. And she says, Mom, how come when we do something truly amazing, the Mexican pyramids, the Egyptian pyramids, when white folks do something really amazing, it's because they give each other awards, and if they built the Empire State Building or the Sears Tower or the Hoover Dam, which won like the award for the greatest 20th century architectural achievement. She says, how come when white folks do something, they get all these awards? When we do something as brown people, it's because aliens came from outer space and helped us. Hello? Is the children are watching. Our young people are watching, and if you haven't problematized that, you're gonna see people, there's something wrong with those who have less or die more, etc. This is a study from my specialty, pediatrics. It looks at how kids are treated in the emergency room. So this is, I think, between all the appendicitis in the nation between 2010 and 2013, 850,000. Now, all of these kids had appendicitis. All of them. We know from the pathology. So you can't say they weren't feeling something not painful or whatever. Okay, so what Nate Cooperman, who's here at UC Davis, and company did was they looked at those 850,000 appendicitis and tracked back to the emergency room and looked like who got pain medicine. What kind of pain medicine did these kids get for the same diagnosis? And this isn't the first time that race and pain medicine has been linked. It's one of the first and most heartbreaking times it's been related to kids. So these are kids 0 to 21. If you are a Black child and you came in with appendicitis, you were statistically less likely to get any pain medicine. If you were a kid who came in and let's say your pain was very severe. Well, let's go back to just any pain medicine. It didn't matter what your insurance status was. So this is not about could they pay for it or not. It didn't matter what gender, it didn't matter what age, so it's not teenagers. In some cases, these were babies. We controlled for all that, right? They even controlled for the level of pain that children were feeling. So you can't say, well, people manifest their pain differently, you know, more, these people are, no. They controlled for pain scores. So if kids told you their pain was severe, like an 8, 9, 10, if you were a Black child, you were statistically less likely to get narcotic pain medicine than a white child. So tell me, what script, what historical script are we living today that would reproduce this outcome even in children? You can chat those. Somebody said immense cruelty, stunning. I don't even think it's about, again, I don't see cruelty in pediatricians. I do see a lot of implicit subconscious bias that explains away Black people's pain. You feel me? Good. So here are some of the scripts that unless you see yourself performing them, unless you hear yourself attributing these scripts to these kids, you're going to do the same thing, I guarantee you. Don't separate yourself from these people in the ER, okay? Don't separate yourself. So Black people don't feel pain. That's from 400 years ago. Black children lie. Very good, okay? The false idea that Black people can endure more pain. What about the historical script of Black folks who are drug seeking or drug abusers? Remember, probably some of you are in my generation, it used to be the crack baby or the mom who was a crackhead. We can't let that happen. That's the script. So that we know that even young people with sickle cell anemia don't get their pain treated because people are worried somehow in their heads that they have the responsibility to keep these sickling patients from becoming drug abusers. Do you see how useful the idea of a script is? I'm not going to tell you whose head not to touch, whose eyes not to look straight in. You know, that's cultural competence, people. Cultural humility is, I'm just as likely as anybody else in this country to ascribe these scripts incorrectly to people and withhold the best that our healthcare system, our public healthcare system, our social service system can give people. Does that make sense? The skill is not how much do you know about Black people. The skill is, how can I make visible the scripts I have for Black folks? How can I hear when I'm cutting some people a break and other people I'm holding to a different, maybe a legal standard? You know, maybe people get suspended for that, but it doesn't explain why Black girls are 5 times more likely to be suspended than white girls. There is something we see when we see Black women, even in their girlhood, that holds them more responsible, that says they're older than they are, that says we gotta really supervise their behavior. Okay, Jeannie Simpson says you are absolutely making sense. Okay, right on, right on. Okay, that sounds good. All right, so somebody said, yep, there's studies that say this is a study of medical students and physicians who are residents at the University of Virginia. Statistically likely to say, more likely to say, these are medical students. Black people feel less pain and have less sensitive nerve endings. Where do you, I guarantee you nobody taught that in medical school. It's like somebody saying it's this cloud. In this case of historical scripts, right? Because this isn't you're better or less than white folks. This is, I get to hurt you and not feel bad about it. That's what slavery was built on, right? That's what medical experimentation on enslaved African women was built on. The father of gynecology, J. Marion Sims, perfected his surgical techniques on enslaved black women. And when he got it good, he switched to white women and used anesthesia. And if you could read his writings, what he would say is, I don't have to worry about that. It's not my issue. Black people don't feel the same level of pain. They don't feel any pain. These residents today, I'm talking about 2016 people, also felt that black people had thicker skin. I guarantee you nobody's teaching them that. It's in the air. So you cannot tell me whether you're white, black, you cannot tell me that you do not have these scripts in your mind. If you say that to me, I will run the other way. If you tell me how great your parents were and how they never taught you to be, I'm gonna run the other way, because these are lessons we all learned about the other. All right, 10-year-olds, white children, they took 10-year-old white children and had them look at a scenario of white children falling off their bikes, black children falling off their bikes, scraped knees, whatever. By 7 years, there was a trend for white children to believe that black children felt less pain for the same injury. By 10, it was statistically significant. No one is excused, people. And these are issues that are as old as our country. This is Thomas Jefferson. He wrote of blacks way back when. Their griefs are transient, those numberless afflictions, meaning what happens with enslavement, are less felt and sooner forgotten with them. So not only do black folks feel less pain, but they don't have the capacity to reflect on that. They won't feel bad about that. Is that true? No, but what does it allow you to do if you say it to yourself enough times? It allows you to exploit and hurt people, right? Without psychological impunity. This makes me wonder about black parents and spankings. Well, I think that's a longer conversation. And just to let you know, we spanked our kids when they were younger. And when that was the language I felt like they could understand, I wasn't going to process with my black children, because that's not what this society wants to see in black children. They need to respect authority and respect it quickly, or there will be consequences. So I get the dimensions of that, and we can have another webinar on that. But yes, if you look up Joy DeGruy, D-E-G-R-U-Y, she talks about that manifestation of physical discipline as a manifestation of the legacy of slavery and black folks. I don't want to talk about that right now, partly because then we're going to be talking about what's wrong with black parents. So yeah, let's talk about black women specifically. So this is a woman from Yale Graduate School. Perhaps you heard about her. She fell asleep in her graduate student dorm, studying for finals. One of her white dorm mates comes by and calls the police because in her mind, the script was, she didn't look like she belonged there. That's a powerful script. That Black women can't be Yale graduate students. It's an obstetrics gynecology doctor who was on the plane. Somebody fell out on the plane. The flight attendant asked if there was a doctor on board. This woman said, yes, I'm a physician. The flight attendant said, no, sweetie, we mean a real doctor. So my point is this, people. We are still living these historical scripts. And unless you can be humble enough to say, yep, that's in me too. That's in my cultural DNA. That's in our collective DNA. It's in our organizational DNA. It's in the DNA, I guarantee you, of academia and universities. That's the skill, is identifying and interrupting those scripts, because we've spent billions trying to end racial disparities. So let's talk a little bit more about that. My friend Jesus Hernandez is an urban sociologist. He says, race is not a category, race is a process. Remember, race is not something our genes do to us. Race is something we do to each other. Here's evidence of that. David and Collins, who are in Chicago, pediatricians, neonatologists, documented that the birth weight of infants of African-born women is more similar to US-born white women than US-born Black women, similar to allostatic load now, right? What they also found was the descendants of European-born white women who came to the United States and gave birth to babies who had higher birth weights than babies of their immigrant grandmothers. So within a generation and a half, let me get this on because my family's up and out now. Okay, let me see this now. And my son taught me this. I have to Logitech. And so can you all hear me still? Somebody say yes.
Yes, we can hear you.
Okay, great. Okay, so
yes, we can hear you.
Thank you so much. So if you are a European white woman and you came to the United States, within a generation, the birth weight of your grandchildren would have risen. If you were an African or Caribbean-born Black woman, within a generation and a half, the birth weights of your babies would be similar to the birth weights of American Blacks. Okay, so there's something about race, that social construction, that constrains our physical potential. Everybody feel me? Race is a social construction with biological implications. So what was done to Black women? We forget. We forget. What have we survived? What is still being manifested in our wombs and in our bodies? Enslavement and the wrenching away of babies, husbands, parents. Remember, and maybe you weren't taught this, after the US Congress outlawed the Atlantic slave trade in 1808, that was put in the Constitution, and there were no slaves coming across the ocean or from South America. Black women were literally bred on slave farms in North America to increase the wealth of their masters. I think that that is not without implication today. Do y'all feel me? This is from Master of the Mountain, Thomas Jefferson and his slaves. Thomas Jefferson, for all the heroism that we attribute to him intellectually and otherwise, was a very brutal slave owner. He did not necessarily inflict the pain, but he ordered it definitely. And he was calculating about what it would mean for him to have slaves. He really did write all men are created equal and all men have certain inalienable rights. I know that he didn't mean that for women, but for men, until he got married and his father-in-law showed him just how much money he could make from enslaved Africans. So this is a quote from him. Oh, this is a quote from Wincheck. It says, again and again, the sale, the hiring, or the mortgaging of black souls rescued the Jeffersons from a bad harvest, bought time from debt collectors, and kept the family afloat while a new and grander vision of Monticello took shape. Wincheck says the slaves formed Jefferson's bulwark, economic, financial bulwark against catastrophe. In 1792, Jefferson calculated that the births of slave children produced capital at the rate of 4% per year. If you get that book, you'll see his notes in his own handwriting. He said, I allow nothing for losses by death, but on the contrary. So if an enslaved African dies, I'm not going to count that against what I've gained. On the contrary, I'll presently take credit 4% per annum per enslaved African was his increase in wealth for their increase. And that was over and above feeding them and however you clothe them. Everybody get that? In the 1780s and 1790s, the astounding total of 143 children were born into Jefferson's possession. So why am I saying, I hope it's clear why I'm making this history very, very clear. That we're still living this historical script. I really believe, and of course, yes, he had black children. I really believe that black women have babies that are smaller than they should be, because within our wombs, within the wombs of black women, literally lives the unresolved history of race relations. Do y'all feel me? That's why I think people use infant mortality as a marker of wealth, of health, and other internationally, because there's so much of it that isn't just about the women, it's about the resources, the politics, the social construction of people at different castes, of different ethnicities. And I think that's what we're manifesting, is that history of that we never taught. We still do not teach our children. And until we get next to this, and what it took for African American women, how fabulous we are that we would survive this. I think we're going to be hamstrung in terms of helping black women to optimize their birth potential and including how we keep them from dying at 4 times the rate of white women. So again, what was done to black women, enslavement and the wrenching away of their babies, their husbands, their parents, slave farms where you literally bred black women to increase the wealth of their masters. The use and abuse of black women to nurse and breastfeed and raise white babies and children. It always amazes me how folks talk about how black women don't breastfeed at the same rate of white women, and how, why don't, historically, that's who was breastfeeding people of Earth. So we got to figure that out and put that back in the context of history, why black women might feel like that's not the most progressive thing I could do. Hello?
We hear you.
Okay, we hear you. Okay,
we agree. Amen.
Somebody say amen. Somebody say amen. Okay, here we go. This is hard for Dr. Jann. I like to walk up and down the aisles and call on people, and you know what I'm talking about. Okay, oh my goodness. Anna DeVere Smith, no, Stephanie Devane Johnson discusses Black women. Okay, very good. I'm gonna get that this morning. Rape and the threat of rape as a weapon of subjugation, to stay in your place. So in the South, in the North, white men could rape Black women without impunity. Just, it was the same kind of message crime as lynching was to all Black people. Of course, the incarceration of Black men who are our sons, husbands, and fathers. Black women as sexual beings, but not beautiful beings. And always the children. We're always worried about our children. Okay, I said that. I'm going to ask you to read Sister Citizen so I can go on to cultural humility. Oh my gosh, I gotta just show you those, Serena, okay? Help me understand. You all have heard about Serena Williams, who I am not, but would love, used to think I was as a tennis player. How come they didn't believe Serena? I want to show you just a brief videotape, and I know we're getting close to 11. Okay, here we go.
What did you say when someone said that our little girl was going to win Wimbledon in like 15, 20 years?
She said, not if I'm still on tour.
Everything went great, and I put a little makeup on so I could take pictures with the baby. And I just remember getting up and I couldn't breathe, and I was like, I can't breathe. Like, I couldn't take a deep breath. I told the nurse, I can't breathe. I need a mask. So I put the oxygen mask on, and I started coughing because I couldn't breathe. It hurt so bad. It hurt so bad. And then my
Y'all hearing that?
Yes, we can hear.
Okay, great, thanks.
just broke. And I remember I was in the bathroom with my mom, and I was just crying and crying. She was crying. She's like, you just gotta breathe. And I was like, I can't breathe. And it was just really hard. After that, I remember being wheeled back to the operating room because they had to reopen my C-section and re-stitch it. And then they had to check for, blood clots and everything. So they were doing all these different tests, and everything was negative. I'm like, listen, I need you to run a CAT scan with dye because I have a pulmonary embolism in my lungs. I know it. I've had this before. I know my body.
She was undoubtedly battling for her life, and I was terrified that she might die. But I was grateful that she had the wherewithal to speak up because she knew her body better than any of us.
The enormity of everything was scary. Unfortunately, because she advocated for herself, they ended up taking her in for CAT scan, and they found the pulmonary embolism.
Every day I was in the operating room for something different. It was one thing after another, and eventually I got another blood clot in my leg. So the decision was going in for a third surgery where they put a filter in me that blocks blood clots from being able to get up to my heart. I was so healthy. My pregnancy was so easy. Like, I didn't have any problems. But unfortunately, once I had the C-section, everything from there was pretty much a nightmare.
So I'm just going to ask you, what are some of the stereotypes of Black women does Serena, and we could go, I've got other women, we just don't have time to go through these videos, but what are some of the other stereotypes? Because check it out. Serena wasn't low income. She wasn't unsophisticated and uneducated. She multilingual. I mean, we could go on. I remember Jann McEnroe one time when she won the French Open. She was so gracious, and her parents raised her amazingly. And Jann McEnroe goes, okay, if she starts talking in French, I'm leaving. So guess what she starts doing? She starts thanking the French audience the audience in France in French. Jann McEnroe stayed there, y'all. But I'm like, tell me what it is that a woman who'd had a pulmonary embolism, who's telling you she knows what it feels like, and I'm having, let me tell you the diagnostic test. We are not listening to Black women, people of Earth. We are not listening to Black women. And I know what they, I know they told her, well, this is your first baby. You don't know what it feels like. And I know they were like, oh, she's the angry Black woman. All these things. When we're not the mammy, we start to disappoint people and people get intimidated. I wish I could go through all these. Yeah, she's strong enough. She'll be okay. They've had babies for centuries, even in the fields when they were working. Yep, she had the medical risk factors for PE, clotting disorder before she was pregnant. Oh, y'all, and had a blood, okay. So we need to think about that. And I just want to end here before I go through cultural humility. But these two scholars talk about what's going on. What are the scripts? Reagan McDonald Mosley, who's at Chief Medical Director for Planned Parenthood, told ProPublica, you can't educate your way out of this Black maternal mortality challenge. You can't healthcare access your way out of this problem. There's something inherently wrong with the system that's not valuing the lives, and I would say perspectives, of Black women equally to white women. Tell them that. Tell them that. Somebody says self-efficacy and self-advocacy is not enough. You don't have the power in that situation. I totally agree, Caitlin. Neil Shah, who's an OBGYN at Beth Israel in Boston, said the common thread is that when Black women express concern about their symptoms, and I know you've seen these other videos, clinicians were more delayed and seemed to believe them less. It forced me to think more deeply about my own approach. There is a very fine line between clinical intuition and unconscious bias. I hope this helps you to put what we're facing, what Black women are facing, and those who want to help them in context. I'm going to go quickly through cultural humility, and hopefully it's obvious why it's not cultural competence that we need to be striving for. We can have a longer conversation about that. Hierarchy of human value, Dr. Bug said yes. Cultural humility is about nurturing a lifelong commitment to self-evaluate. You cannot say that you went to Dr. Murray's webinar. You cannot say that. Do not even use my name in that way. This is a lifelong commitment. It's a journey I'm still on, even as a Black woman. Redressing power imbalances. How are you going to make it so Black women believe they can teach you about what's going on in their bodies, their families, their extended families? How do you minimize those power imbalances? How do you develop in an ongoing way mutually beneficial, non-paternalistic clinical and advocacy partnerships with communities? And then how do you do all those things at an institutional level these three things at an institutional level. Stewarding cultural humility, that developmental process on that level. We have just a few more minutes, right, Dr. Bug? Let me ask you a couple questions, and you will have this PowerPoint. But if you could take yourselves or your organizations or your girlfriend group or whatever it is, and take yourself through these questions. Nurturing a lifelong commitment to, who do you have in your professional and personal community who can challenge your scripts? When is the last time you saw a movie or read or listened to a book about a community with whom you work and should know more about? How did it impact you? Redressing power imbalances. Have you witnessed a colleague have a script challenged by someone junior to them? Maybe a student or a colleague. I'm guessing that the further you go up in your organization, I know this is true with universities, the less diverse it gets. And so there's not just that racial power imbalance, there's that supervisory, academic degree power imbalance. Have you witnessed a colleague have a script challenged by someone junior to them and get defensive? Or feel like that correction is a threat to their identity, personally and professionally? Is there a family, youth, woman, or others you serve whose behavior you pathologized or caught yourself before you pathologized? Developing mutually beneficial and non-paternalistic clinical and advocacy partnerships with communities. Are you in mutually beneficial relationships with community members you expect your colleagues or supervisors or students to learn from? Let me ask you, do they get paid to teach your staff or your students? As staff development and other academies get paid to teach your staff? Or do you pull community members in, taking their time away from their thinly resourced community organizations, thinking, oh, it would be good because we don't have a diverse faculty. It would be good for people to see these amazing Black women or Latino advocate, and you pull them away from their work that they're getting hardly any money for, and we don't pay them to come in and lecture to our classes. That's not mutually beneficial. You may think you're complimenting them or giving them props, but just think about kind of the colonial structure of academic health professions and public health training. Who has the expertise really, and who's getting paid like they have that expertise? And then organizational level developmental process. So let me just talk about, what do I mean? So is your organization committed to this lifelong commitment to self-evaluation and self-critique? You know that, you all know this graph about maternal mortality in comparison to other Western nations. In California, while the nation's maternal mortality has gone up, ours has actually halved. Let me tell you why that is, because the organization that's working at the state level with the California Healthcare Foundation actually took data from hospitals, actually took data from individual obstetricians who said, no, my C-section rate isn't that high. No, I don't do more C-sections on Friday so I can be left alone during the, I don't. And they actually gave the data to each physician. That's self-reflection and self-critique. You have the tools to do that. And doing that and having, the emergency kits and protocols that you don't think about differently for different kind of women, but they're just protocols that you do for every woman. That's how we get out of our implicit bias. Again, if the outcome is the same, you need to go back and look at a script that is making it so. If you continue to have not a diverse faculty, not a diverse graduate student group, if you continue to need to go to underpaid community members for your cultural expertise, that's an outcome that's as old as the hills, and it needs to be interrupted. I'm going to go ahead and take a couple questions. Of course, there's much more. I wish you will see their slides that I didn't get a chance to go through. I wanted to put them there in case we did have that time. But help me, are there questions I can answer or comments that you want to make? Does anybody want to say amen? Does anybody want to ask me a question that I can answer in the next 5 minutes or so? Oh, bunches of amens. Thank you, amen. Amen. Okay, great. And let me know how I can continue to be of service to you all. And thank you, Kim Marie, for Dr. Bug, for the compensation that you gave me for this webinar. I know that we get millions and millions of dollars to do this, just to decrease maternal mortality. You need to figure out how those funds can go to the ground, to the Black women who are in these communities, who can speak to Black women about our collective identity. It's so important to measure what's happening, but that can't be, you know, we're not going to measure our way out of health inequities, right? The health inequities are not a quantitative problem. It's not that we don't know how to measure them, right? It's, are we teaching our students about history? Are we teaching our students about how our institutions are manifesting that history? Okay, let's see. Oh boy. Let's see, as a patient, wow, lots of questions. As a patient, how can I help to change the script? So there are a lot of sisters groups, and the thing that's worked in Sacramento that I've seen is really connecting older Black women. And in our case in South Sac, these are women who are paid to be birth coaches, more than doulas, but pregnancy doulas. Black women with the wisdom and respect of the community who are paired with young women well before the births and then afterwards. If you are not in a leadership role in your workplace, how can you support Black colleagues and allies with them when leadership falls into hidden scripts? Well, that's more of a community work. Kim Marie.
I'm sorry.
That's chapter 7. I'm gonna tell you what. But, that's a community organizing script about how people without power can get their message across. But there's a reason why we haven't been successful in doing this, and it's about power. It's about who's promoted, who's mentored, who's doing the research. So until people can be convinced of that value, and this has to happen horizontally across the country, because it's just not fair to think that people who are not at your level of not education, but of supervisory roles are going to confront you about things that could be done better. I would like to think that we could create those atmospheres where that is true. And I think I bet you Kim Marie could develop some coaching around how do you hear the critique about your organization, your institution, your academic department without then retaliating emotionally or psychologically against the people who are challenging your scripts.
Yes. So
This is
Dr.
why, can I just say one more thing? This
Yes.
is why I tell my students, I don't do diversity training. I do identity work. And it's more than one presentation. Yes, Dr. Buck, sorry.
That's okay. Thank you so much. So this is what we've been building up to. Our webinars have been building on each other with the intention of, this is a project that is taking place over the next 4.5 years, working with these participants in this learning lab. And so we wanted to start with my own bias self, and then how to talk to people, and now how to be culturally
humble.
Thank you, humble. Yes, I felt my preacher coming out of me.
No, I know,
pastor.
But it's
yes.
an orientation. It's not a destination, right?
Yes, absolutely. And so we also are going to have this Friday a office hours where we will discuss what was in your presentation just with each other, just to mull it over, to really get the feeling, because we of course don't want to just leave it this wonderful presentation. And so we will continue to build on it. But we are just so very thankful for you being here. This is amazing.
Well, awesome. I'm so glad.
And we definitely need more. So as we continue to when we're able to do some in-person things, I just know that we're definitely over these next couple of years are going to have you in person to do some of these with us.
I would love that. The worst thing I can do is do one presentation, and people are actually worse off than if I'd never come to do anything, because I've opened up issues. So I'm so glad to hear that you're doing something on Friday. And Dr. Bug, you know how to get in touch with me.
Yes, yes. Okay. And Tamala, can I turn it over to you to close us out?
This is Linnell. I'll close us out. Okay. We at the Maternal Health Learning Innovation Center want to hear your feedback on today's webinar. Thank you so much, Dr. Murray-García, for sharing this very important and impactful information with us. Please give us feedback. It should only take a few minutes to fill out, and let us know what you think. Thanks, and have a great